struggling to sit down for like 30 years because of her back pain. And then it took a while, but within a few months, it got to the point where she could sit for an hour and it wasn't painful. Then was able to fly to Australia and stuff like that. So then she'd message me like, oh, it's unbelievable, I can do this, this and this. And when you're like, right, she hasn't been able to do that for that long, then I'm part of something that's made her able to do that. That's a good feeling. So my name's Mark Leyland. I am a sports physiotherapist. So I work for myself, working out of Block 27, and then I work up in London as well at the clinic. I'm qualified as a chartered physiotherapist, and then I've done other qualifications in sports physiotherapy. So worked for a football club for 4 or 5 seasons, and then I've worked with a lot of other sports. So it's a physiotherapist who's more inclined with treating sports people, professionals, performers, etc. I qualified 10 years ago, but I was working in the NHS for 10 years before that. So I came into it a weird way. I was working as an unqualified, it's like a physio assistant, and then sort of promoted through, worked, and then did my degree while I was working in the NHS. By the time I qualified, I knew a fair bit about what I was doing, so then went private as quick as I could and started working for the football teams, and then progressed on from that point to then running it myself. So before doing my first degree, I was a lifeguard, I was a roofer, labourer, warehouse, you name it, manual jobs, I did it. And then went to night school while I was roofing, and then got in to do my first degree, which was sports science, and then did my physio degree after that. So work-wise, I worked doing those jobs and then worked as a physio assistant. So the biggest thing with being a physio is being able to talk to people and anyone. So you've got to deal with, you know, kids to people in their 80s, 90s, people who've got learning difficulties, people who've had brain injuries, people who've been in big traumas, and then people who've just got little aches and pains in different places. But then you've got people who earn 10 grand, and you've got people that earn 10 million, and everyone in between. So you've got to be able to talk to people. That's the biggest thing with the job. If you can't communicate, you won't be a good physio. Yeah, and that's the job. It's the same, like, physio is the same as nursing, the same as most of these healthcare jobs. Like, you need to be good with people. If you're not, you can have all the knowledge in the world, but if you can't talk normally to someone, then it doesn't work. Like, you can talk in fancy medical terms and try and make yourself sound clever, but if I can explain it in normal everyday language to yourself, then it makes way more sense than me saying fancy Latin names for this and that and la-di-da-di-da. It doesn't mean anything. You're like, okay, why does it hurt? How long is it till it gets better? That's what almost people want to know. So you've got to be able to, you've got to have the knowledge and you've got to know this stuff, but then you've got to be able to put it out at a level, whoever's there. Like, you might allow doctors or surgeons I've treated, therefore you need to talk a bit more medically to them, and then, you know, a 12-year-old who knows nothing about it, you've got to be able to talk it at their level. Otherwise, if they don't understand what's going on, they're not going to buy into what you're saying. So yeah, so I guess I was working NHS and private, so that's how I merged the two. So I was full-time NHS, but then like a couple of evenings doing private stuff and doing my own bits. So you end up, for a short period of time, you're working a lot to then try and build the private stuff, and then get to a point where you're like, right, I think that can grow, now I can drop the NHS and then focus on doing the private stuff. But then I combine that with working with the football team as well. That sort of happened at the same time, so both worked out okay. So that's how I managed to slip from one to the other. So initially I did it in a spare room in our house when I had a spare room. So I used to have people come there, or I had a couch, so then I used to go to people's houses, then started to develop it more into a screening type process. So I'd have people who are doing certain sports and screen them in terms of mobility, strength, and everything else they needed for their particular sport, and then try and build it up from that point. So it's not just treating people once they're hurt, it's trying to prevent things from happening and then trying to take a performance twist on it in terms of, this is why you can't do this. If we get better at doing this and this, that will translate to this in your sport. So trying to make it a bit more diverse rather than just like, oh, my back hurts again. Okay. Typical day. Answering emails, phone calls and admin stuff, which is not the fun side of things. Otherwise then booking in patients, I have to do all the admin things. So otherwise then I'll have a certain number of patients in per day, and that can vary one day to the other. Whether I have them back to back or whether I'm in for part of the day, go home and then back for the evening. It just varies day to day. So no 2 days are ever the same really. Some days are really busy, other days it quietens down. But physio's a funny business. So most industries you're looking at marketing yourself and trying to get as many people coming in. But then from a physio point of view, you're trying to get them out as quick as you can, because what looks good for me is you come in with horrible pain, I do stuff, you get better, but then you're not coming back. Like if I do a good job, you'll tell other people, which is then the best way of marketing. But from a business point of view, I'm putting effort into getting people coming in, but then if I'm any good or people are responding well, they stop coming fairly quick. So then as a business model, it's not great. You're kind of fighting yourself almost. If I got someone in and I treated them for 20 sessions, say, that'd be perfect financially, but I don't ever want to treat anyone for that long. So ideally someone comes in, you treat them a few times and things get better and then it goes away. But then you've then got to keep a constant new people coming in, which just ebbs and flows depending on, like, if it's sunny or people go on holiday and other stuff happens. Yeah, it's tricky. I guess the most rewarding is when someone's in real trouble in terms of pain or really can't do something, and you can take them from a point where they can't do anything to then the point where they can get back to running or training or whatever else it is, depending what they've had go on. And sometimes that happens in weeks, sometimes that happens in months, depending what's been going on. But like selfishly, like you get a good feeling from helping people. So me, I hate the social media side of things and trying to promote everything, marketing and admin, but that's what you have to do now. I get a lot of business, or most of my business comes from word of mouth. So people are like, oh, so-and-so said to come here, etc., etc., which is good, but that's just marketing by luck, really. It's not trying to put things out there. So the marketing sides I hate doing. Too old, too ugly for doing social media. The other sides I don't enjoy is you get some people just with crazy expectations of like, oh, I've ruptured this, I've got to do this in 2 weeks. And you're like, right, there's biology and then there's what you've done, and you can't cheat that. Like if you've done this amount of damage, the body takes this long to heal it. It can help, but I'm not a healer. But some people are like, oh yeah, but I've got to do that. You're like, okay, just trying to sort out some people's expectations is tricky. And then the first time I came across physio, I think I was 14 and I dislocated my kneecap playing football. The first time I went to see her, it was horrifically painful. But I remember the thing that stood out to me, I went there at sort of a 2 o'clock on a Friday and I was her last patient. She was finishing up. I was like, any job where you finish at 2 on a Friday, I was like, that can't be too bad. She hadn't really done too much apart from hurt me and give me a couple of exercises to do. So I was like, oh, maybe. And then kind of messed around a bit at school, wasn't great. So I had to kind of come to it through a kind of back route almost. But I think I've been away one summer and then came back, didn't have any money, and there was a job going at a hospital. So I was like, cool, I'll just go and work there for a month before I go back to university, and then started off being an assistant then, and then it just carried on and built up from there really. And so when you're training, you have to do, it's like 1,500 hours in the degree where you're on placements, and those placements could be anywhere, in any hospital, like big hospitals, small hospitals, or you might be in community where you're just out driving around seeing people. Then what you tend to do is qualify, and then most people will go into hospitals, and then it's called their junior rotations. So you'll go to a hospital trying to apply for a job, and then everyone that's new will spend X amount of months in one discipline. So you might be on elderly ward, and then you go into orthopedics, so post-surgery, and then you might go into another area, and then you tend to rotate around for a year, 2 years, something like that. And then you choose your favoured discipline from there, and then you try and get a job in that, and then you try and progress through the ranks in that position. Yeah, like it's super hard now. So I think it's the most oversubscribed university course now, physio, or it's one of. So a lot of them you need straight A's at A levels, which I didn't get. You need to be in biology at least, and then I can't remember what the other ones are. But yeah, I wouldn't be able to get in there. Yeah, you see, you need that, and then there's only certain universities you can go to, so it's tough to get in there. But then it's a 3-year degree. Then a lot of people do masters afterwards with rotations and everything else. So it's a long process, and it's because most people will go straight into the NHS. It's not well paid at all. So if you're going to university now, you're coming out with 30, 40 grand in debt. But most starting off physio jobs like 19, 20 grand maybe. So it's tough. You have to supplement your income at some point, I think. But then to go private, a lot of the time you've got to have a certain amount of years qualified, so insurance companies cover you. But also if you've done the rotations, you need to know what you're doing. When you come out of university, the vast majority of them, I don't know what you're doing. Same thing as driving. Like you pass your test, then you learn to drive. It's the same thing. You pass your degree, then you try and actually learn. Right now I'm on my own. Someone comes in with this and that. How do I deal with it? And yes, it's tricky initially. You've got to diagnose what the problem is and make sure it's not certain other things that you can't treat. Then you've got to figure out a treatment plan, and then yeah, it's hard when you're first doing it. Work experience. Try and find someone you can go and hang out with. Hospitals are generally fairly good, but you need to see what the job actually is, because it's not running onto football pitches and treating footballs. It can be, but there aren't many that do that. It's a very small percentage, and people aim for that, which is fine, but that you've got to go through a lot of other stuff first. And if that's your ultimate aim, you can do it, but you've got to go through a lot of things first. So you need to figure out if you're willing to sacrifice lots of money and lots of years to get to that point. I definitely think with physio, you shouldn't go from A levels, do the degree, and then start working. You need to have some time away and just see what real life's like. Like go and work in different places, travel around a bit if you want to, but get some life experience, because the worst ones I ever came, or worst physios I've ever come across, are generally A levels, done their degree, come straight into work, and just don't know how to talk to people. And that's the job. It's just good to have some perspective, which if you go, I think with any job, if you go straight from university straight into work and you've not done anything else, that's all you know. It's good to have a bit of knowledge about the rest of the world. Communication's going to be the main thing. You've got to be able to retain some knowledge. So with anatomy, we have to learn all the muscles, all the bones, and everything else. You do need to be able to retain that. And then, as I said, with anything, is you do the degree, then you learn what you're doing afterwards. It's then what you do postgraduate. So a lot of people do master's degrees. I never did that, but I went and did another course in the States for a year, which then just progressed my knowledge of mechanics and human movement and everything else, and that's what I do now, and that's what I teach as well when I'm not treating. So you've got to be happy to push yourself in other directions, because there's loads more than you get taught in the degree. I still have to do it now. I still have to read a lot, listen to podcasts, which makes things a lot easier, but it's a constant evolution. The guy I did my training with in the States, who's a professor of physio, is super clever, reckons he understands about 6 to 7% of how the body works. So I'm like, right, I'm way behind him, so it maybe puts me around 3%. So then I've got 97% to learn, which for me is good, because then I know there's a lot more to it. Whereas if you see a lot of physios are kind of the easiest ones to talk about, they wouldn't see it as that. They're like, oh yeah, like I know 70, 80%, and they'll see it as they know the vast majority. And I was in that position and I hated it. But once I had my eyes open to it a bit more, I was like, oh, okay, there's a lot more to this I don't know, which that makes life more interesting. So generally, day to day, I speak with surgeons. So either I see people here that I then have to send for surgery if they've done something bad, or other people who have had surgery, the surgeons send them to me, so that I kind of talk quite regularly with them. Other physios, osteopaths are probably the other ones, and podiatrists who deal with the feet and orthotics and things like that. They'd be the main people I deal with. But then again, when I was working the football, it's different. You've got to liaise with coaches and other staff, like strength and conditioning guys, so I always speak with the coaches here if they're training someone that I'm treating, or vice versa. You've got to be able to liaise with them, and what can they do, what can't they do. So those are the sort of things you have to deal with. And then insurance, admin. From my point of view, there's no, because I'm working for myself, there's no like progression, there's no ladder of, oh, I can then go and do this, or I can then go and do that. Education wise, I could go and do a master's and I could go and do a PhD, but I haven't really got any interest in doing that. So in terms of career progression, I guess it would be building a bigger business and having them people working for you, but I'm not that interested in doing that. I prefer I'm not a great businessman, I don't like the admin side. I guess if I could get a business person in, get them to do it, that would potentially be a way of doing it, but I'm not interested in doing that myself. So it would just be doing what I'm doing, making sure I keep busy. I'm going to go back to doing more teaching probably, so running courses for other physios. So that's another avenue of things I'd like to do more of. But yeah, there's no stepping stone. In the NHS you're going at this grade and then you work your way up and then you end up in management and then wherever else. But it depends which avenue you want to go down. You can go down the education side and do your doctorate, or you work for yourself, or you go to a sports club and then work your way up to the head. It all depends what you want to go into. But for me, yes, probably doing this, but then doing more teaching. So I think with anything, you end up where you are because of what you did or you didn't do. So then I probably wouldn't want to change anything, because I'm happy with where things are. Like, my path would have been way easier if I'd actually listened at school, tried in exams, and then just done A-levels and then gone straight into the degree. It would have saved me time. But I think going the other route gives you a lot more life skills, and that's probably helped me way more than the education. So I'm not sure I'd change things that way. I think the thing I didn't realise with physio, and it's the thing most people see, is a lot of people will see someone like me, so they go to the doctor, if it's NHS, and it's like, right, I've hurt my back. You wait way too long, and then you go and see someone in a hospital, and it's like in and out of a little room. But that's their general perception of what a physio is. Like, I've hurt my neck, I'll go and see a physio. But when it comes to the training, like, maybe that's 20% of the job. The vast majority is dealing with people who've had strokes, like amputees, people with respiratory problems, pediatrics, are little babies, you're on intensive care. There's loads of other parts to it that you don't see, and they're all the bits that you have to do in your training. People see physios as like, oh, that's the guy or the girl that runs on in the football match or the rugby match and everything else, but that's such a small percentage of the physios, but it's what you see generally. You have to do all those other bits in the training, which for a lot of people is like, oh, that's a big shock. Like being in hospitals with people that are really ill and dying in some instances, and then having to do stuff is very different to then someone walking in and going, I've hurt my ankle a bit. I think you've got to figure out whether you want to earn money or whether you want to love what you're doing or combine the two. I'm sure there are ways of combining the two and earning a ton load of money by loving something you do, but there aren't many people who find that avenue. So yeah, I think there is a bit of a choice. Like, I definitely don't go into physio for money because there isn't that much. If you get the top positions in certain football clubs, you can earn very well, but that takes a long time to get to that point. You've got to do it because you want to help people and you want to increase your knowledge and your skills and everything else. But yeah, for me, you want to find something you think you're going to love doing, and then going to work isn't a hassle. Like I don't have the Sunday fear. So for me, that's a good thing. Whereas I know a lot of people that Sunday afternoon is the worst point in the week because then you've got the thought of 5 days of work. I never have that because I love what I do. So for me, that's a good point. Your earning capacity is obviously not the point as if you were a banker in the city, but yeah, I don't have the fear, so it kind of works for me.